Hi, my name is Shabazz Ahmed, and my topics are therapeutic management and pharmacological therapy of HIV in pediatrics. The World Health Organization now recommends that all diagnosed infants and children less than 2 years of age should begin antiretroviral therapy regardless of the child's clinical or immunological state. The United States recommends treatment for all infants with HIV regardless of their CD4 count, clinical status, or viral load. The most effective treatment for children with HIV is antiretroviral therapy, and this requires the use of several antiretroviral drugs to be taken every day for the rest of their lives. As with adults, the antiretroviral therapy with at least 3 drugs is recommended for children, as this prevents HIV from becoming resistant to any single drug. It is usually recommended that this therapy should consist of 2 nucleoside reverse transcriptase inhibitors, or NRTIs, combined with either one non-nucleoside reverse transcriptase inhibitor, an NNRTI, or a protease inhibitor, a PI. Now, there are many factors that can influence the choice of drugs for children. Considerations about medication that the mother may have received during pregnancy, the toxicity of certain drugs, and whether the child is still breastfeeding, all need to be taken into account when choosing a drug regimen. Now, when it comes to therapeutic management, one of the big nursing concerns is adherence, and whether the child adheres to their drug regimen. Children on HIV treatment need to take 3 or more types of antiretroviral drugs every day for the rest of their lives. If the drugs are not taken routinely at around the same time every day, HIV may become resistant to the therapy, causing it to stop working. Now, there are many factors that can lead to adherence problems. There could be inadequate dosing, there's a high pill burden, there might be a reluctance among young infants to take the syrups or powders due to their unpleasant taste. There might be dietary restrictions and toxic side effects of the drugs. Among older children and adolescents, there's a variety of social factors such as fear, stigma, discrimination, stress, and anxiety, peer relations that may impact treatment adherence. Side effects and the need to take the treatment at different times of day also explain why adolescents may find it difficult to adhere to their treatment regimens. Another main nursing consideration is the nutritional support while on HIV. Ideally, children living with HIV who are asymptomatic need to consume 10% more calories than other children of their age and sex. Children who are symptomatic or are recovering from acute infections need to consume 20 to 30% more calories than other children. If a child is suffering from malnutrition, it is recommended that they receive treatment to stabilize their condition first before antiretroviral treatment is started. Now, when it comes to dosing, the dose of antiretroviral drugs is given to children is generally based on their weight or body surface area. Since children's bodies are constantly changing and developing, it is often vital that the drug doses are altered to ensure that the child is not given too much or too little of a drug. The study of how the child's body reacts to the medication is pharmacokinetics. The pharmacokinetic properties such as absorption, distribution, metabolism, and excretion of the drug all affect the efficacy, toxicity, and dosing regimen required in a child. Now, when it comes to therapeutic management, one of the big things we avoid is to prevent the patient from receiving opportunistic infections, which take advantage of the weak immune systems and are a serious threat to children with HIV. The 2 big ones are tuberculosis and PCP, or better known as pneumocystis pneumonia, which is a form of pneumonia. Which these 2 are like a major cause of illness and death among infected infants. Now, due to the weak immune system, children living with HIV are very vulnerable to opportunistic infections and need to be provided with appropriate drug prophylaxis to prevent such illnesses. For example, for PCP, the antibiotic cotrimoxazole is an antibiotic that is included with PCP prophylaxis and can prevent other infections such as TB. It is recommended that all children born with HIV-positive mothers should be provided with cotrimoxazole until tests confirm that they are HIV negative. Now, children that are at risk are particularly risk for TB, particularly if they're suffering from a weak immune system due to HIV infection and the mother is infected. I should have stopped it right there. Fuck. Stop it at 4:30, right before after I finish the cotrimoxazole sentence. I think. Yeah, I'm not gonna do this over. Stop it when you feel like stopping a cat. Bye.